And finally we are going to perform a preeclampsia screening with prenatal screening cloud. As we have seen in previous videos, we enter in the application with our email and password facilitated when we have registered. Once we are in the app, we click the button New and select the test that we want to realize, a preeclampsia screening test, and then the button Create Screening. As we have observed in other types of screening test, appears a screening form that we must complement with some data to compute the risk that the patient develops preeclampsia during the course of her pregnancy. The screening form is structured in various sections. The first section is called Patient Screening, where we give a screening code that will allow us to identify this screening. The screening date, if we click it appears by default the current date that we can select. The date of birth, where we enter the patient's date of birth. Below it the option Race, Ethnicity, where we can define patient's ethnicity, because some ethnicities have a correction factor associated that modify the MOM of biochemical markers. Also we should inform the weight of the patient that modifies the MOM values of biochemical markers. Unlike the aneuploidy screenings, in the preeclampsia test we should report the height of the patient that permits together with the weight to compute the body mass index which is necessary to calculate the preeclampsia risk. Besides, there is an arterial tension frame where we should enter the value of diastolic and systolic pressure. It's recommendable entering at least one measure of the systolic and diastolic pressure of each arm, and also we have to inform the date of the arterial tension measurement. The next section is the one called Pregnancy, where we inform about the smoking habit, insulin-dependent diabetes, or if the pregnancy had ovulation induction. Because all these three categories in case of a being affirmative applies a correction factor. If it is a twin pregnancy, we can define the placental type, monochorial or bichorial. In the preeclampsia screenings we find also a frame called maternal markers that contains some fields like nulliparous, chronic hypertension, renal disease, etc. that we can report. If we know the information with a yes or no, those fields in case of being reported have an associated likelihood ratio that modifies the risk calculation. The following section is blood test, where we should enter the values of the biochemical markers, pregnancy-associated plasma protein A and placental growth factor. In both markers we can select which units are we going to use, as well as the brand of the reagents. Also, if we have the MOM of the biochemical markers, we got the option to use them. However, we recommend to define these parameters at the time of configuring the account. We should also enter the blood test date, that can be the same as the screening date, or other date. If the markers are measured in different dates, we can specify them. After filing the biochemical data, the next section is ultrasound, that allows us to report data regarding the scan exploration. We enter the CRL measurement that permits to compute the gestational age, and the ultrasound date, that can be the same as screening date or not. In the preeclampsia screening there is a frame called uterine artery Doppler, where we inform about the pulsatility index of both uterine arteries, right and left, and the date of measurement. At the bottom of the screening form, we find at the left side a section of previous anomalies where we can inform if the patient has suffered preeclampsia in a previous pregnancy or if a relative has suffered preeclampsia. Those options work like the maternal markers, and in affirmative case the risk of preeclampsia increases. Also, we can inform if the patient has suffered from a previous pregnancy with intrauterine growth restriction. At the right side there is a section called Optional Gestational Age that facilitates different ways to compute the gestational age if the CRL is not reported. Entering manual gestational age in days and the date. or we can use the last menstrual period at the conception date. We can click the button, Save Changes, and automatically the risks are calculated. At the right side of the screen will appear the risk computed if we have entered all the necessary data. From top to bottom we can observe the following data. Risk positive and negative for a cutoff 1 to 250 for early preeclampsia and 135 for late preeclampsia. The risk computed for early and late preeclampsia and the basal risk for early and late preeclampsia when the risks are negative are shown in green color. When they are positive in red color and the basal risks are always displayed in yellow color, then we may observe the computed MOMS for all the Gaussian markers used. There are the values of each marker and the corresponding MOMS for the respective gestational age. Below we find the gestational age at the screening date and the expected date of birth, the correction factors that have been applied in this screening, and finally the button Generate Report. If we click the button Generate Report, automatically appears a frame that allows us to add information and then will appear in the printed report as the name and surname of the patient and the possibility of adding screening comments. After, we can click the Download Report button and the report in PDF format will be created. If the report has been generated correctly, appears a message advising that the report has been downloaded successfully and we can check the download folder of our browser. If we open the report, we can observe that collects all the information about the screening. At the top right of the report, we find the header title, the header subtitle 1 and the header subtitle 2, defined at the time of configuring the account. Then we will find the results of this preeclampsia test. In order, first we find patient data, name, surname, screening code, date of birth, ethnicity, weight, height, body mass index, arterial tension media, screening test date, and the correction factors, smoking, diabetes, and ovulation induction. At the right side the blood test data, their values and the blood test date. The ultrasound data, ultrasound date, CRL measurement and the average of intrauterine arteries per elasticity index. Below there are the screening results, the MOMS of the Gaussian markers, data relating the gestational age and the expected date of birth, and finally the risk of early and late preeclampsia. The risks are shown as positive, negative, in numeric and graphic representation. Then the screening comments that we could add when generating the report, as well as another comment indicating that this is a statistical calculation and no has diagnostic value. At the bottom right we find the signatory doctor defined at the moment of the account configuration and the report date. We have learned how to perform a preeclampsia screening with Prenatal Screening Cloud.